You can stay in the room.
There wasn't much. And obviously I paid attention to March 2020, which was the time when the restaurants were most affected, up to last week, actually. So let's begin with Starbucks. Here you can see some images from the official Starbucks Facebook page, posted before the pandemic reached the Western world. Most of them were reposted on December 21st, 2019, as those that in the company's eye illustrated the passing year best. So these are the images that the company identifies itself with. So these represented major events in which many people took part, a sense of togetherness and community established, which is in line with our perception also of coffee as a social drink and drinking coffee as a social activity or ritual. The other category of images present in the profile depicted coffee shops products, usually cups of coffee. And here just one example of this is given on the left, because they all seemed quite the same. And Starbucks reacted to the news of the pandemic on March 19th, 2020, on Instagram, saying, "We're in this together, caring for our community is our top priority." So the post was followed by others, all representing only illustrations and text, no photos, until March 26th, when a photo was posted showing an employee with a small bottle of sanitizer. There's the employee in the middle bottom part of the slide. So she's got a sanitizer tied to her apron, but no mask, no gloves. And there was a comment in which the company offered all frontline responders a free drink at particular shops in the US. So next came more illustrations, with only a few exceptions, which could be interpreted as a demonstration of the company's understanding of the gravity of the situation. It also made an impression of a responsible approach, increasing distance with the customers, but still remaining friendly and proactive. Photos were again posted frequently after approximately 2 months. And the posts you can see here come from 2021, and the content of the photos or the visually organized text in one of these has changed. What we see now are mostly individual people with their coffee ordered to go, or employees sharing their personal stories, telling how the company helped them when they were in need. We even get a video of a conversation between a customer and an employee via a service speaker. So that's the one where the lady covers her face. That was some parental advice on behalf of the service person. So pictures of beverages, especially presented outdoors, are still common. I just put here 2 of them, but there are many. But there are also many pictures and videos of people enjoying their coffee alone, but doing things that are fun. Okay, in case of McDonald's, or actually McDonald's Poland, which loaded automatically when the page was opened, and unfortunately I found no way around it. So when it comes to McDonald's, the content of the posts on Facebook has not changed since before the pandemic. They contain both photographs and illustrations, some of exactly the same kind, such as those taking the form of a test or featuring a young celebrity. So evidently they are addressed to a specific age group, that is children, teenagers, and young adults. As this demographic group has been least affected by the virus, perhaps that is the reason for little change. Little as McDonald's did react to the news of coronavirus, expressing their concern for the health and well-being of their customers. That's the second road against red background. The first row is obviously what we got before, and the bottom one, the one that we've got now, and there isn't much difference in the content, in the colors, in the format. The company ensured in March 2020 and that they took all the necessary measures and even more to keep their employees and visitors safe. They facilitated touchless service points in their restaurants where drive-through was not an option, and also informed the public about having engaged in delivering free food to medical staff. Otherwise, the communication hasn't changed. So it was all about fun, meeting with people, and celebrities tests, and going to McDonald's because your younger sister is organizing a pajama party. ChickfilA, another American chain restaurant, introduced more COVID-related changes in their social media communication, just like Starbucks. From images of groups enjoying their meals and spending time together, and that's the top row, they went on to posts on delivery options, introducing individual employees responsible for the incoming orders, and thus reducing the anonymity of such interaction. So that's the bottom one. Additionally, they declared upholding traditions in the new version of the world. They also underline their engagement in social matters and encourage employees to grow. All the photos of the staff inside the restaurants depict people wearing masks. They are portrayed individually or in small groups, only outside the enclosed spaces, like in the last post. They take their masks off and join bigger crowds. So in March 2020, ChickfilA kept informing their customers about their changing policies, that's the middle row, reassuring that they deliver the customers' favorites to the doors and provide the little things to help take the mind off the big ones. So the message was built upon or revolved around the relationship between the company and its customers that was started before, and making sure that the latter, that is the customers, could count on ChickfilA. So surprisingly, the top restaurants in the world followed McDonald's footsteps and remained focused on the work and interests, only informing the public about the fact that they followed governmental guidelines or closed their doors when the restrictions were imposed. So the first row, that's before the pandemic, then the post informing on changes, and then what it looks like now. So at a time when the restrictions were imposed, Norma introduced prepayment vouchers, allowing guests to secure their future booking with some additional benefits, which received a wry comment, business as usual, from a visitor that perhaps expected a different, more empathetic approach. Odette, the middle one, launched Odette at Home. The post stated that Chef Julian and the Odette team have curated an elegant showcase of iconic and seasonal plates available for takeaway to create their clients' own multi-course Odette experience around the table with their loved ones. Obviously, that's a quote. So the last one, Central, took a different approach and maintained that, and then again, a quote, their method would be the same, always thinking of unifying people and promoting collective work and creativity, and hoping for it to be shared also in other spheres besides gastronomy. So the statement was consistent with their previous work towards sustainable food production and respect for culture and tradition. And other than that, the communication focused on food preparation, fresh produce and dishes having the appearance of works of art. So apart from the reaction to COVID, nothing really changed. Also, the restaurants engaged much less in responding to the visitors' comments than the previous group of restaurateurs. One might conclude that the relationship of these top restaurants with their customers resembles an artist admirer or leader follower arrangement, in opposition to the chain restaurants assume the role of a caring and responsible friend that is part of the community. So finally, some additional examples taken from Facebook pages of popular restaurants in Poznań, Poland, that's my hometown. I decided to include them as they became the inspiration for this project and can be treated as a representative of certain trends that are best explained through a qualitative rather than quantitative analysis. So what one can observe here is that most of the pictures were taken outdoors, and many emphasize dedication to make the dining experience safe for the customer. Many of these outlets introduced green, healthy snacks and drinks as a way to encourage the customers to come, and also a way to show their commitment to the customers' well-being. What's interesting, there appeared many posts calling for a common effort in fighting the COVID fallout in the food service business, either in the form of getting takeout or paying for meals that the establishments would deliver to hospitals, to the doctors and nurses taking care of the sick. And such a direct address has not been accounted for in previous material. So the analysis showed change within all three Hallidayan layers of meaning. That is the representational meta function. And here we could mention conceptual processes such as the occurrence of new attributes, that is masks, gloves, sanitizers. The interpersonal, mostly shots of individual people or products, and the appointed standpoints of both the establishments and the patrons. And the textual or compositional, so the significance attached to certain elements and the framing of the information. It seems evident that the selection of information and the emotional load of the posts were to mark the establishment's position in the new reality and improve specific roles on the customers, roles of those who receive care, the caregivers, or simply spectators. So has COVID-19 changed the dining landscape? Well, for the most part, yes. It led restaurateurs to redefine the relationship with their clients, promote an image of a safe space, and evoke a sense of warm fellowship, saying we're all in this together. Okay, so this is it, and thank you very much.
Hi. All right. Thank you very much. Thank you, Anna. How about any questions? Anyone? Do you have any questions for Anna? It was very interesting to see the restaurant reactions or non-reactions.
Or non-reactions.
Yeah. Very, very strange. Would anybody like to ask a question? Who's got their hand raised here?
There's one, Ian.
Ian.
Hi.
Oh, there you are, Ian. I couldn't see you.
Hi, hello.
Hi.
Fascinating work. Thanks very much. I enjoyed the bit of that which I saw. I unfortunately had to dash in late. But in South Africa, where I'm from, we had obviously lots of restaurant closures during the lockdown. And so the industry suffered a whole lot. So when restaurants were coming back, we found all kinds of sort of save this, save your favorite restaurant, please come and support us, kind of more sort of, I don't know, begging role, or support the waitresses and waiters at your local, those kinds of things. Did you find evidence of those kinds of posts?
Yeah, there were many evidence. There was much evidence about such occurrences in Poland and in well, my environment. Let's say I got a lot of that. But then when I analyzed what the big chain restaurants did, or the top restaurants, then not really. Well, I think that maybe their position is so well established, and well, the chain restaurants had the drive-throughs. I think that they didn't get that much less customers, much fewer customers, because they were one of the few open since they had the drive-throughs. So maybe they didn't have the need to be rescued. But on the other hand, I don't know if it's cultural, that in all three were American. Perhaps, I don't know, that's just my interpretation, that it shows like a weak part of the industry to ask for help. And then in other cultures, it was different. But then the three that I mentioned, the top restaurants, they were from different cultural backgrounds, and they were not American. They were from other places, but it still didn't do that. I think that Noma did something, like when they opened, they sold burgers, because they said that it takes time to go back to the way Noma was. So for a couple of days, they served burgers, and you could come and collect them. You couldn't eat them at the restaurant, and they sold out in 5 days. So probably they had so many customers that they wouldn't really have to ask for more.
Okay, thank you. Anyone else? I would certainly agree that fast food places had it a little bit easier during the pandemic, because they were already set up for it. But interestingly, they seem to be somehow more empathetic or more reactive, which I still think is a kind of strange thing that the other restaurants did not really.
Mm-hmm. Yeah, I think that the difference is between how much power you have. If you are a big corporation, you have so many PR specialists, and they know exactly what to do to turn this into a good thing for the company. So this is one. Then I had all those examples from my playground, let's say, and they the people, the small restaurateurs, they also connected with people, and there was a big movement of helping the doctors and nurses in Poland. So in March there was this hashtag Save Gastro. This is a rough translation, and many restaurants delivered to hospitals, and then people paid money for the meals. So there was this cooperation and empathy, but the top of the top, not really. So I think like those, they as I said, they were kind of artists and leaders, maybe more artists than leaders, who just thought, we are here to do the best of the best, and we are not actually sympathizing a lot. It's business. So that comment was the one that Noma got was very striking. It was business. Business and 3 dots and as usual. So it showed like what they care is just business, and that's it.
I mean, speaking as someone who lived, like all of us, through this COVID thing, I really think that the fast food places helped everybody, and they were in a better position, of course, to help everybody. But looking back, I'm trying to think how we would have gotten through some of these moments without them. I never go to Starbucks, and I don't like McDonald's, but I'm thinking in particular of Taco Bell or any of the others for that matter.
Mm-hmm.
But I think they were really helpful to people. And local restaurants, not necessarily such highly rated ones. Local restaurants really had difficulty in finding their way, what they were going to do. Of course, they were limited because they had no facilities. Then in New York City, they started allowing dining out in the street on the large, we have wide sidewalks in New York City.
Mm-hmm.
But I personally don't like to eat on the street in New York City. It's dirty.
Mm-hmm. Yeah.
I don't like cars going by and that sort of thing, but that also helped people eventually. But and now we're faced with various problems because of that, but that's a different issue. But it's interesting how multimodally they were lagging behind
Mm-hmm.
the fast food places.
Yeah.
Any other comments? We have a couple of minutes left. No? Well, thank you very much.
Thank you.
I think it was an important thing to look at. I think, we do react as linguists. We want to react to what's going on around us. I didn't write anything about COVID. My only really contemporary thing I wrote about was when we suffered from Superstorm Sandy in 2012, which was a very large storm. If you weren't here in New York or New Jersey, you might not remember it as well. But that was interesting in terms of studying public officials and how they dealt with the public during the storm. So that's what I was looking at, specifically the two governors. But yeah, thank you. And we'll now have, sorry, I lost my schedule. Who is next? I'm trying to tweet out things while everybody's talking. Next, we have Mariana Pascual.
That is right. Thank you, Jackie. Thank you very much. First of all, I want to thank Anna for a very interesting presentation. And well, now that I have been taught here in the audience, I would also like to take the opportunity and thank the organizers for an incredible event. The organization has been really, really outstanding. Yes. So let me share my screen with you, and I'm going to start. And I think it is exactly the right time for me to start. Yes, it is. Okay. Well, as you can see there, I'm going to be talking about the dimensions of attitude in the discourse of women with chronic pain. My name is Mariana Pascual, and I am originally from Argentina, but I have been living and working for the last years in Santiago de Chile, and that is my current affiliation. Yes, so I'm going to be talking about the objectives. I will present the pathology, endometriosis, then I'm going to describe my corpus and characterize it, make some references to the analysis and results, and I also want to focus on the challenges of the analysis, all appraisal analysis and this type of analysis in particular, and then some final remarks. Yes. So let me tell you that I have two main objectives in mind. The first one has to do with one specific pathology, one specific disease that is chronic. So we want to know how women suffering endometriosis, which is a gynecological disease characterized by chronic pain, how these women construct their experiences with the condition, yes, how they word their experiences. Then we hope that in turn, this will contribute to a better understanding of their experience and to improve their communication with the social actors with whom they interact. And I'm thinking not only in terms of the health personnel, but also their families, relatives, and co-workers, and many other people that they share their daily activities with. Well, so let me refer to the pathology, to endometriosis. I know that some of you know what it is, but some others still don't know. And this is the first thing that calls my attention, because this is a pathology that is very, very frequent. Yes, it's higher in prevalence than breast cancer and than diabetes. So it's incredible that a lot of people still haven't heard about it. And if you consider the number of people who suffer the disease, we're talking about over 70 million women in the world who have already been diagnosed and are at present suffering the disease. So there is no agreement in terms of the percentage of incidence, but we can say that it ranges from 5 to 15%. This is not because of some other social factors, but because many a times the disease is not diagnosed or the results are not reported. The symptoms of endometriosis are very severe pelvic pain, infertility in many cases, and dysmenorrhea among several other symptoms. But probably you should know that about 50% of all cases of endometriosis are diagnosed in cases of infertility. Patients resort to the medical system to see why they cannot get pregnant, and it is then and only then when they get to know that they suffer from this condition. So the problems that these women suffer, as you may imagine, have a terrible impact on their life quality, especially because of the severe pelvic pain. So there are many questions that emerge when we refer to this. It can cause, as you can see here, one of the ideas is that it causes a pain that is incapacitating. So this brings about an idea of disempowerment in women, in those patients who suffer from it. And this is something that has been repeatedly reported in the literature. And we may also notice that it is overwhelmingly frequent and that it has terrible, devastating effects. And nevertheless, it has been traditionally ignored in health discourse literature, in the literature. So there are certain questions that we may ask. For example, why is it that not a lot of people have focused on this? Is it because it is a gynecological pathology? Is it because it is suffered only by women? It might be a reason. And the other element that may contribute to the lack of studies on the pathology and on the discourse related to the pathology has to do with the normalization of pain. You know that there is this contradiction of elements in which, on the one hand, women are portrayed, they are represented as the weak sex. But on the other hand, we should be very strong, and the pain that we suffer is supposed to be normal. Yeah, so this is something that definitely does not help. What are the consequences of normalizing the pain? Well, basically, the life quality of the patient is impoverished. There are terrible effects in terms of sexual life, in terms of work, in social life, many terrible effects. And of course, if they don't believe you, if your pain is normalized, the problem is that the diagnosis is going to be delayed. And what happens with when the diagnosis is delayed, your health is even poorer than before. So if we analyze the studies that have been developed on discourse and health, there are several pieces of research that have focused on doctor-patient interaction and also on institutional work. But it has only been recently that we have turned our attention to the patient's voice, yes? And it is here that we are focusing on Facebook comments, and we are also analyzing some interviews that we have conducted with endometriosis patients. Today, I'm going to be referring to the first corpus. I'm going to be talking about the Facebook comments. Unlike my predecessor, unlike Anna, I'm going to be talking about a publication range that goes up to the outbreak of the pandemic, because we wanted to focus on some other elements, and the pandemic, the outbreak of the pandemic marked a clear contrast with our data. So it is about like 6 years, 2014 to 2020. As you can see, the amount of data is quite big. We are talking about over 3,000 comments. You know that Facebook comments vary very much. They can be very short or very long. In our case, we are talking about 73 words in average. And in the for the analysis, we used manual analysis, but assisted digitally. In this case, we used en vivo with the new edition, which is the 2020 edition. So we used the original version of appraisal, the system proposed by Martin and White in the year 2005. But because of some difficulties that emerged in the analysis, we had to resort to more recent developments and more recent comments about the methodological problems that you may come across when you analyze this type of discourse, particularly when you are analyzing oral discourse or discourses that resemble oral communication. So here I'm going to make reference basically to the critics posed by Thompson and Alvarez, but also to Matteo Folli and some other scholars who have also contributed very valuable ideas regarding the analysis. This is what a Facebook page looks like. The information is public, but the people who can have access to the information, they have to request permissions, and once the permission is granted, you can access all information. This is an example of the basic kind of information, but for you to have an idea of the type of content, the experience that we are getting here, this gives you a very clear idea that endometriosis patients worry about the disease and the endometriosis, but here you can immediately notice that there is an interpersonal component that is also very, very important in Facebook comment exchange. There are several other elements in a second layer of analysis that emerges. And of course, one of them has to do with pain, because pain is a very frequent element, as we will see. And the idea of time is very, very relevant. And the idea of time is relevant in all discourses that relate to health. Well, I wanted to show you what the analysis looks like. Fortunately, you can retrieve the comments automatically using NVivo. And this is the kind of, you have to insert the categories and you determine what kind of information you're going to code. So for example, here you can see that we determined to make a distinction and specify whether the coding was direct or whether it was indirect. For example, in the case of health discourse, in the case of suffering as a result of a disease, you have bodily manifestations, which can be quite important. Well, we also wanted to notice metaphors, not grammatical metaphors, but conceptual metaphors, tokens of value, the type of polarity, and we classify the type of affect that was involved, because this is a type of discourse that is going to be construing values that relate to affect all the time. Well, this is for you to have an idea, and let me show you the results that we got in our first analysis. As you can imagine, the value with the highest number of occurrences was the disease, endometriosis itself. We got nearly 1,700 instances, and that is why we decided to see what happened within this category. And within the category, we had several other subcategories that have to do with the diagnosis, with the visibility of the condition, with pain. You can see a very high number. To other patients, which emphasizes that idea of a very interpersonal kind of discourse. And here, the highest number corresponded to the treatment. So again, we decided to see what happened within the category of treatment, and we had surgery, tests, medications, alternative treatment. So this is the kind of information that we got. So when we looked at the type of affect that was being construed, we discovered that the results were incredible. It was unhappiness, basically, and insatisfaction. They were the predominant type of effect, but when we analyzed the composition of unhappiness, this was something that really surprised us. A very, very high number of instances that construed sadness. Yes. So, for example, you have some cases here. It's very sad not to be able to be a mother, terrible pains with the permanent crying. The disease has produced terrible harm physically and emotionally. I lost hope not to be a mother again. Well, that kind of sadness. So when we analyzed the type of attitude that was being coded, we discovered that in most cases, there was a great feeling of insatisfaction, and this is just an example of the coding that we did. but in most cases, it was inscribed through graduation. But as you can see here, there was a clear evaluation of the typing satisfaction, recognizable, but not directly. And as this also indicates that indirect judgment can also be identified. You can see it very clearly in the example. La única forma de que me detectaran la enfermedad fue asistir por sospecha de infertilidad en el sistema público. We have here a lot of experiential meanings, yeah? Es la única manera que exploren con mayor detenimiento los casos. So it is an attitude that is being encoded through experiential meanings. In particular, and because I don't have a lot of time, I want to show you what we found in relation to that dimension of unhappiness, which was so prominent in our corpus. As I told you, the type of meaning that was characteristic in this type of discourse was unhappiness. And how is unhappiness construed in this type of corpus? Well, you refer to pain, our patients refer, not our patients, our subjects refer to pain, basically, which could be of two different types, emotional as well as physical pain. When they refer to the emotional pain, we are talking about fertility and in most cases, infertility, effects of life quality, the idea of sympathy that they need, that they expect from other people around, and the very important role of diagnosis and the important role of information in their experience with the condition. If we move to physical pain, references were made basically in three different areas. First of all, the discomfort in itself, then the effects on the sex life of the patients, and then treatment, the pain that they suffer because of the treatments. You know that treatments could be of different types. They make reference basically to surgery. Some of these patients have already been through 7 or even more surgeries. The impact of the medicine, because sometimes in order to relieve the pain, they have to suffer some other consequences. And then the alternative treatments. I have 1 more minute, so I'm going to refer to the challenges of the analysis. Yeah, the blurry boundaries between categories, between appreciation and judgment, they are present all the time. But again, here I want to make reference to something that a lot of authors have already posed, which is the Russian doll dilemma, that in this case you have one type of evaluation within another and within another. And in studies like this one, in which we are numbering, it's a mixed method research. So this is very important, yes, because you count the number of instances, but this does not mean that they are all equal and that they all carry the same evaluative weight. Yes, so that is really a problem. I also want to make reference to this idea that in some genres, particularly when we are talking about the spoken mode or the hybrid modes or modes in which you have a combination of different types of elements, oral and written, most of the evaluation is in the context. Yes, so sometimes it is very difficult to categorize something that you know is there, but that leaves basically no linguistic trace. So that is quite difficult. And in order to account for the differences in intensity of evaluations, we need to resort to some other meaning-creating resources. And we know that a lot has to be said about this, because the intensity of the evaluations is something that varies, changes very much from even from one context to another. Even the same evaluative element can have clear different intensities. So to finish, I want to emphasize that the values of affect that predominate in the corpus relate to the idea that here we're talking about some sort of autobiography. The speakers were telling their own experiences with the disease, and that is why we have this sort of configuration. They tend to refer to their experiences with the condition by constructing values of unhappiness, basically very profound feeling of sadness and dissatisfaction, displeasure and discontent. And that is very important because that is something that doctors do not usually pay attention to. And when you see a person for 10 or 15 minutes every 3 or 4 months, you cannot usually see the sadness that the patient is going through. So sadness was significantly related to pain, and both emotional and physical pain. We know that sometimes people tend to focus on the physical pain, but the emotional impact that chronic disease and chronic pain may have on the patient is also very, very important. And we need to consider that this type of discourse domain when designing patient-centered health actions, because what we're doing here is trying to improve health communication, trying to describe what the patients are going through, and in the long run, we are trying to help them have a better life quality. Yes, so these are some of the references, and thank you very much.
Thank you very much, Mariana. Now, do we have any questions or comments for Mariana?
I'm going to stop sharing the screen so I can see everybody here.
Questions or comments? Is there some way, Mariana, for you to share this with the doctors who treat patients with endometriosis?
There are several ways in which we can share this with the doctors. One of that is one of the most important elements, because one of the main contributions is sharing this with doctors and with professors of health communication in the medicine programs in the universities. You know that nowadays, in order to become a doctor, you need to take a course that is called health communication. So this can help them become aware of how important it is to focus on certain elements. Yes, especially in the case of chronic diseases. Yeah, and that is something that we do. That and most universities nowadays, they have medical humanities. I don't know if you have it in your universities, but most universities have interdisciplinary centers in which we get together and we contribute from different disciplines, trying to get a better understanding of the pathology. And that is what we are trying to do.
Thank you. Very good. We have a question from Teresa. Unmute yourself, Teresa.
I have a lot of problems understanding hearing you, Jackie. Yeah.
Oh, okay. Teresa, you have a question?
Yes, Teresa has a question. Yes.
Thank you, Catherine. Thank you, Mariana. It was very, very interesting, very nice and important research. So congratulations. That's
Thank
first.
you.
And I was wondering, because of course it is very difficult to work with the original categories that Martin and White proposed. And well, they said that it was a proposal. It was a, and especially regarding affect, right? And so I was wondering, Mariana, if you had, what kind of criteria or what kind of problems did you have regarding sadness, you know, that is clear that is unhappiness, but then sadness regarding to pain, and why no insecurity? Why not insecurity? So what kind of reasoning is behind that, that the pain, I understand that can be emotional and that can be a physical pain, but why dissatisfaction was not the main category, you know, if you can expand that, because I imagine that that was a problem to put where to put the pain, basically, and the different kind of pains.
Well, you can imagine that that was one of the central questions that we had, yes, because pain is our big problem, and pain is a big problem that our patients suffer, yes, and our subjects. So basically, and this is what I was referring to when I said that the boundaries were not very clear.
Mm-hmm.
When you're talking about feelings of frustration, this can be considered probably dissatisfaction, because you don't get a diagnosis as soon as you should get it. But the problem is that when it becomes something that is recurrent over time, after years of dissatisfaction, patients become sad. Yeah. And that is, in the literature, what has been described systematically. There's some sort of passing from dissatisfaction to sadness, to unhappiness. And that is basically what happens in a chronic disease, and that does not happen in the case of some other diseases. Yes, in the case of some other pains. And that is also one of the main differences between physical pain and emotional pain, because there are various types of pain. And usually when it is physical pain, you relate it to dissatisfaction. Yes, and patients describe it in terms of dissatisfaction. But when patients refer to chronic pain, they resort to values of unhappiness. So it's quite interesting to see that after many years of suffering, dissatisfaction becomes sadness, which is also terrible, which is also very, it's something that has not received enough attention. So, and doctors don't treat the emotional pain, but they focus on the physical pain. And what we are doing now is trying to see whether there are differences in the lexicogrammatical construction of physical pain as compared to the descriptions of emotional pain. And in order to do that, we have resorted to an interdisciplinary group of researchers, and we're working with, for example, psychologists that are trying to help us determine where the emotional pain begins and where the physical pain finishes. And because, as you can see, the boundaries are never very clear. Yes, the examples that you get in books are very clear, but then when you go to a corpus and when you go, and the same is happening now that we are analyzing interviews, we are facing the same problems. That there is a lot of dissatisfaction that comes together with unhappiness, or that in turn becomes unhappiness. And that is terrible. That is very sad.
Yes, it is. And so what you said, Mariana, is that you're making distinctions between the kind of pain and the emotional pain and the process and kind of the time with the sickness that the person, the woman has. And so that can be in both categories, depending on the personal experience and the time that they have been experiencing.
That is definitely what happens. For example, if you, in our interviews, it is very clear that in the case of young women, they show dissatisfaction. But in the case of older women who have been suffering the condition for several years, they show sadness.
I have to stop you here because we're already into the time for the next presentation. Thank you so much, Mariana. Very interesting presentation and useful, I hope. Yeah. Thank you.
Thank you very much.
Next, we have Caroline.
Hello.
You should be able to share your screen, Caroline.
Let's see.
You did it before, you'll be able to do it again.
Just a minute. Can you see?
Yes, yes. We can see you and hear you.
Thank you. Just a minute because okay. Good afternoon. My name is Carolina Guimayer. I'm from Brazil, from Universidade Estadual do Centro-Oeste do Paraná. The title of my presentation is Attention, Flammable, Warnings of Hand Sanitizers, a Forensic Linguistic Analysis. Oops. I can't go on. Okay. Sorry. So the pandemic of COVID-19 has causing a huge impact on our lives, especially on our cleaning routines. We clean and disinfect the surfaces daily, wash our hands frequently, wash and disinfect food and package. Everything that comes into our house, we clean. The demand for hand sanitizer has grown exponentially, and the supply chain was not able to keep pace with that demand. It's important to point out that the ingredient of hand sanitizers in Brazil is ethyl alcohol 70%. Anvisa, which is the Brazilian federal agency responsible for promoting and protecting public health, has relaxed some of hand sanitizer regulations. RDC 350, 2004, 2000. I can't see my slide. I don't know why. Just a minute. Okay. Allowed the sales of hand sanitizer of liquid hand. Oh, sorry. Allowed the sale of liquid hand sanitizers. This kind of hand sanitizers was forbidden since 2002 because it is highly flammable and causes several deaths annually. This slide shows some accidents arising from hand sanitizers: burst, poisoning, eye injuries, and also burns. Some of us are so focused in disinfection that we forget the dangers of hand sanitizers. But I want to pose a question. Who is legally responsible if the consumer suffers any harms? Warnings puts on the consumer's shoulders the responsibility for prevention, even if the labels are difficult to understand or are incomplete. In the case of warnings, the exchange is successful and thus efficient if the reader complies with the command. So, based on it, my goal is to evaluate the efficiency of hand sanitizers warnings through the analysis of 3 aspects: fidelity to Anvisa's requirement. Anvisa is the Brazilian federal agency responsible for promoting and protecting public health. The types of message and modality based on Halliday 1994, and the characteristics of the warning messages in terms of comprehensibility, which will be verified under the light of previous forensic linguistic studies: Schei, Tiersma, Dumas, Coulthard, and Aguimeyer. The departure point to evaluate the labels is the definition of a warning. According to Schei 2002, a warning should identify and describe the nature and danger of the risk. Then they should tell the reader how to avoid it. Finally, they should communicate those things in clear and understandable language. So here we have 3 very important components: the risk, how to avoid, and a clear language. Aguimeyer 2016 points out that warnings should be visible and easily identified. She also asserts that they should persuade the readers to comply with the saved messages. This is very important because sometimes the reader can understand the message and choose to not obey them. It is also important to have information regarding the consequences, since they may increase hazard perception. Furthermore, warnings that states how badly a person can get hurt, rather than, or to a lesser extent, the likelihood of getting hurt is preferred and is because it's more persuasive. Here we have the components according to the American National Standard Institute. So a good warning should have a signal word. In the case of this label, we have the word danger, which is a strong word. Then we have hazard identification, which is flammable. Then how to avoid it: do not pierce the lid. The consequence, we don't have the consequence of it explicitly. It is implicit in the first aid information that we have in case of burning, wash the area with water. So burn is only mentioned in the first aid information. Furthermore, you can see in the label that the speech acts are mixed, directions, ingredients. So it's difficult. First, it's difficult to read because the font doesn't help. As method, I analyzed 16 labels, 5 from liquid and 11 from gel, which were transcribing, and we have a total of 249 informational chunks. I also analyzed the guideline for hand sanitizers, RDC 46 2002 and RDC 350 from 2020. It's also important to point out that it's a mandatory warning, which, according to Ask Haven-Zensen 2008, emanates from a legal directive and are introduced into the community by regulatory force. So the reader doesn't participate in the construction of the genre. Also, I analyzed the modality and the lexicogrammatical choices. So the reader, so the participants are very important here, the relations between them. And the participants involved in the communicative exchange are the writers, who are specialists and represent the manufacturers, and the consumers, who are ordinary readers who sometimes possess little linguistic knowledge, and very often little knowledge about the content. Obviously, there is a great difference in terms of knowledge, and therefore power between the participants. This slide shows the mandatory warnings. So we have 9 mandatory warnings. Let's remember the risks that I presented at the beginning of the presentation. So we had 4 risks: poisoning, burst, burn, and eye injury. And do you think that all these risks are presented here? Then we have a table. So my first question was related to the mandatory warnings. As we can see here, there are 9 mandatory warnings, but this information here in red are missing information. Only 4 labels have all the 9 warnings. Number 1, number 11, number 12, and number 14. Number 13, for example, we have only 2 mandatory information and 7 missing information. In relation to the risks, the information "do not pierce the lid" was missing in 7 labels. "Do not spill over fire" in 6 labels. In case of burn, wash the area with running water in 5 labels. All of these risks are related to burn, a very serious risk that can lead a person to death. In relation to the type of warning, we have 7 which demands goods and services, and 2, related to given information. Most warnings are imperative, which are clear in relation to the prevention of the risk, like do not swallow, which indirect tell the reader that the product involves some risks, but in this case, the actual risk is not made explicit, which is poisoning. But the use of imperative is positive because whenever the writers modulate the proposition and proposal, they raise a certain amount of doubt in the minds of the readers, even if a high model marker is used. There are just 2 informational warnings which advises the risk. One is flammable and the other is it contains a denaturant. This product contains the denaturant, the natonium benzoate. In fact, this ingredient, which I didn't know the meaning before doing this investigation, adds a very bitter taste to alcohol, to the hand sanitizers, and it does not affect, it is not a risk for the consumer. This table here shows the amount of information from each label. We have 9 mandatory warnings, but the writer can add more if they want. For example, label number 14, we have 28 informational chunks. Number 9, only 6. In relation to the exchange, 209
Caroline, can you hear us? We seem to have lost connection. Caroline? Oh dear. There you are. You're muted now. You're muted. Unmute yourself.
Hello,
Unmute.
I don't know what happened. I think I lost my connection. Just a minute. Just a minute. Now I can't open. My connection is very, very bad. Sorry.
It's okay.
Okay. I was here. Okay, so we
You
had.
have 10 minutes. Well, let's say 12 minutes left.
Okay. Okay.
Altogether.
Okay. So, So in relation to polarity, 97 negative and 152 are affirmative. Let's talk about the additional warnings. Do not use to disinfect food was present in 5 labels. Do not use it for intimate hygiene in 2 labels. And also do not swallow, avoid inhalation, aspiration, eye contact, and skin contact in 7 labels. I wanted to add that this last warning here groups 5 different information, and this is negative because it reduces the locutionary force of the act. Also in relation to the risks, in relation to poisoning, we have the word denaturant, which is a technical term, and it affects comprehension. But in relation to the first aid, we have the words neither and immediately that brings strength to the warning, because the reader can infer that it's an important direction. The word danger is appropriate, but the word flammable, no, because we don't have the severity of it. It should be highly flammable. Also, in relation to the additional warnings, one of them adds, wash the area with plenty water for 15 minutes. Only one ad bring this information, which is important. Almost all them doesn't bring this information and renders the warning very vague, renders vagueness. In case of mild burn, wash the area with warning order. Only one warning adds this word mild, which brings me, wow, so the burning can be stronger, yes. So finally, my final remarks, 85% of the labels were in disagreement with Anvisa's guidelines. Anvisa's requirements should be reviewed because they should state more clearly about the risks. Imperative brings efficiency since it does not allow alternative actions, and few information related to the consequences in terms of severity and probability that should be inferred by the readers. So studies reveal that explicit consequences tend to be more persuasive and may affect compliance, which is the main goal of warnings. In relation to the first aids, the analysis showed that warnings related to intoxication and eye contact are more efficient than the warning related to burns, which is the worst danger in terms of frequency and severity. Thank you very much. And sorry about the...
Thank you, Caroline, very much for that interesting presentation on something that is near and dear to our hands, in particular, this hand sanitizer. I'm not too keen on it. I prefer wipes or something. But anyway, there have been so many instances of misuse of the sanitizer that it's alarming. Does anybody have any comments or questions for Caroline? Anyone? I was thinking that these companies that create the hand sanitizer or things like that, even regular kitchen chemicals, should really have a clearer message. I mean, your study is proof of that. But I think, during the pandemic, that really came to the fore. People were mixing bleach and ammonia. I think that's what causes chloroform to be created. So they were passing out. People were drinking the chemicals to try to get rid of COVID. So many insane things result from not sending out a clear message. Whether it's the government sending out the message or the company that's creating these substances. So it would be good if your study results could influence companies and the government various governments to clarify their dangers, the dangers of these substances.
Yes, because the focus of them was to offer the product instead of offering information. And after like 2-3 months, at the beginning of the pandemic, we have seen many very serious cases resulting was a result of improper use.
Yeah, it's kind of frightening. Anybody else want to say anything? I can't see. Let me just double check. I can't see everyone. Well, thank you. It was very informative. And hopefully we will get out of the pandemic so we don't have to use so much of it. It's not really the kind of thing we should be putting on our skin all the time. But thank you for your study.
Thank you.
Very revealing, really. Thank you. The next person presenting is, check the schedule, Ian.
I think it's me. Thanks.
It is you. It is you. So you can share your screen when you're ready and take your time. We're a little bit
All right.
ahead of you.
Just check, can you see a PowerPoint slide?
We can.
Okay, fantastic. Sorry, I'm just navigating. There we go.
Take your time. We're ahead of everything.
Fantastic. Great. All right. So good afternoon or good evening from here in South Africa. Today, I'm going to give you a brief look at my research on COVID-19 news reporting from South Africa, showing how our meaning-making resources for making sense of the virus developed during the early stages of the pandemic. So just to begin with, I'd like to talk very briefly about the theory I'm building on in this research. First of all, we know that in systemic functional linguistics, a distinction is made between different timescales. So we have logogenesis, the unfolding of linguistic resources over the course of a single text, like a news article. Ontogenesis, the development of a particular person's linguistic resources. So that's an individual's meaning-making resources. And then phylogenesis, the development of a particular culture or society's linguistic resources. The fine-grained tools of analysis that SFL offers are really excellent at analyzing the development of meaning-making on a logogenetic scale. But in Martin's words, one of the problems we have is that our current realizational technology means that we can only model ontogenetic and phylogenetic change as synoptic snapshots of the meaning potential that exists at one time and then another. And I rub up against this problem a bit in my research, as I'll reflect on in my conclusion. One useful tool from corpus linguistics I've found to model phylogenesis is the concept of collocations, which I'm sure most of us are familiar with. Collocations are words that show a strong likelihood of appearing close to a particular search term in a corpus. I use these collocations of specific words with each other to cue me towards possible couplings in the data. So couplings obviously are ways in which meanings combine across strata, systems, and modes. Of course, collocations and couplings are not the same thing, but I found collocations a powerful way of finding repeated couplings in my corpus of news articles. I'm looking particularly at couplings of 4 different types of linguistic resources: technicality, grammatical metaphor, and then attitude and graduation from appraisal. And throughout this presentation, I use color coding, these particular colors, to refer to these 4 sets of resources. Now, let me tell you a bit more about the corpus that I've used for this project. My corpus consists of the first online news article in the daily morning email newsletters from IOL, News24, and Times Live. And these are the flagship mainstream news outlets owned by the 3 biggest newspaper-owning companies in South Africa. I've collected the first article in each of these morning newsletters put out by these outlets throughout 2020. So that amounts to an average of 68 articles per month. I've drawn a graph to give us a phylogenetic view of what linguistic resources were found in the top 10 collocations of COVID from March to December 2020. So this gives us some idea of what the word COVID was coupling with in the news coverage over these months. The first known COVID-19 infection in South Africa arrived in March 2020, as it did in many countries. And in December 2020, we were well on our way towards the peak of our second wave of infections. That peak actually happened in January 2021. I've shown the rises and falls in COVID-19 infections in black, measured in average daily new infections. When it comes to linguistic resources, just to remind you, these are linguistic resources which were found in the use of the top 10 collocations of COVID in my corpus for each month. So we see there's a big spike in the use of attitude in May, and then there are smaller spikes of technicality in June and October. What could be responsible for these developments? Well, May was a time in which the peak of the first wave was still to come, and people were very uncertain of how our medical facilities would cope with it. So it was a time of great anxiety for many. There were also intense debates about how strict our lockdown regulations should be at this time and between different political parties. And so this is probably reflected in the high number of attitude instantiations or collocates that instantiated attitude. In June, the many examples of technicality seem largely to come from one speech, which was made by our Minister of Basic Education, Angie Motshekga, about the readiness of schools to reopen after COVID-19 safety measures had been put in place. The speech was very influential. It was reported on by all 3 news outlets, and the minister used very technical, almost obfuscatory language in the speech, which was then quoted verbatim. So we ended up with a lot of technicality there. October 2020 was firmly in the trough of infections between our first and second waves. But at that stage, there was early discussion about the readiness of South Africans to accept COVID-19 vaccines. And there was also an article about the fact that COVID-19 antibody tests were expected to be available in the country soon. And so these seem to have pushed up the use of medical technical terms in the news in that particular month. But in general, what we see is a slight increase in the use of both grammatical metaphor, technicality, and attitude if we look from March to December. Now, to see the extent to which these trends were borne out in the logogenesis of individual articles, I compared 2 sample news articles, one from March 2020 and the other from December. The first article is SA's healthcare system has only around 3,000 critical care hospital beds available, and it is not enough. This was published on the 20th of March 2020 by News24. and it features more of the top 10 collocates of COVID than any other article in the corpus for that month, including escalation, space, mild, suspected, positive, and although. So that's why I selected this one for microanalysis. For December 2020, I chose "We buried them because of COVID-19. Nurses drained as virus cases climb," which was published on the 2nd of December by Times Live. This article features a very unusual collocation between the word COVID and the name Piga, which appeared 4 times. And this refers to Sister Lama Piga, a nurse who happened to be interviewed in this article. This is evidence of a particular type of news article that was particularly prominent in December 2020, and particularly in Times Live, which were human interest stories featuring the experience of individual frontline healthcare workers. The article also features a collocation between the word COVID and spike. There were other articles in December 2020 that contained more collocates of COVID than this one, but they were on vastly different subject matter. This article, like the March article, has the healthcare system as its field, and so it seemed a better article to compare with the March article. So let me show you what these look like. There obviously isn't time to walk through a detailed analysis of both articles, and they're long, 1,000 to 1,400 words each, but I'll show you a brief analysis of selected parts of each article so you can get a feel for how the different linguistic resources couple in each. So let's start with the first one from March 2020 with the headline and the first paragraph or the lead. So together, these form the macro theme of the article, and so they're obviously a point of strong textual provenance, establishing evaluative prosodies that run right through the text. As with the tables, the color coding I showed you earlier, I've color coded the linguistic resources found in the text to enable you to see the couplings here a bit more clearly. As you can see, the word healthcare is a grammatical metaphor. In only around 3,000 critical care hospital beds available, we have a complex coupling of different resources. I coded the word critical as invoking insecurity. Although the effect of this attitudinal meaning is a bit mitigated by the fact that critical care is a technical term, a patient in critical care is still in a very precarious condition, and many people might have feelings of alarm on seeing that word. So that's why I coded it that way. Critical also acts as an instantiation of graduation, upscaling the intensity of the care required. The word care in critical care is also a grammatical metaphor, although of course its use in the technical term means it's something of a dead metaphor. I've coded available at the other end of this nominal group as an instantiate as a positive reaction, because it is a good thing for hospital beds to be available for use by patients. Not enough is a very strong inscription of negative valuation. The beds available are insufficient for the demand that COVID will place on health facilities. It also invokes disinclination in this context. The shortage of beds suggests a future situation which readers would rather avoid. In the lead or first paragraph, underprepared is a negative capacity judgment towards the country, and this is upscaled by woefully, which also inscribes unhappiness in its own right. Next, we have an example of the collocation between escalation and COVID-19. As I pointed out earlier, escalation instantiates attitude, so there's some disinclination there. Graduation is upscaled, there's a grammatical metaphor, and it's a technical term. So this is an extremely strong four-way coupling of meanings. In roughly 3,000 out of about 7,000 critical care beds, we have a slight expansion of the only around 3,000 critical care hospital beds available from the headline. In the rest of the article, it isn't very clear, at least to me, what this roughly 3,000 out of 7,000 means. But my interpretation is that the country has a total of 7,000 critical care beds, and 3,000 of those were opened and available for use by COVID-19 patients during the pandemic, with the other 4,000 occupied due to other needs. Public and private healthcare sectors is a technical term, and this refers to how South Africa's healthcare system is split into an expensive private healthcare system that's usually accessible only to patients with medical aid, and an inefficient and poorly run public healthcare system, which cares for the poor majority without medical aid. In best estimates, a positive reaction is coupled with the number of beds available, and estimates, obviously, there is a grammatical metaphor. What this brief example shows is the ways in which insecurity, disinclination, and negative capacity predominate in this article, along with high prevalence of grammatical metaphor and technicality. Frequently, the negative attitude couples with grammatical metaphor, creating expressions which are packed with both ideational and interpersonal meaning. And these are used to make far-reaching generalizations about the capabilities of the country's healthcare system, which may well have caused alarm among readers. A very different picture emerges from the December article. You can immediately see from the screen over here, the headline and lead, that there are no instances of grammatical metaphor or technicality at the beginning of the article, only attitude and graduation. In the headline, we have clear unhappiness invoked through the word buried. The word drained is the beginning of a strong prosody of dissatisfaction, rather, in the article. And it also includes infusing, upscaling, intensification. The word drained arguably has a stronger meaning than just tired. Virus cases climb also invokes insecurity, which is upscaled by the word climb. In the lead, there is plenty of graduation. Drawing to a close upscales the proximity of the end of the year, while across SA upscales the distribution of the nurses interviewed for the article. Drained is repeated from the headline again. And then the metaphor of nurses battling on the COVID-19 front line is an interesting one. It invokes nurses' sense of insecurity, and the upscaling graduation of proximity in frontline strengthens this evaluation significantly, giving a vivid image of the danger the nurses are exposed to. The second paragraph of the article, which we've got here, is where we're introduced to Sister Lama Piga. This paragraph speaks of her as working at Carltonville District Hospital on the West Rand. That's a small town, Carltonville, 80 kilometers west of Johannesburg in Gauteng province. Here, district hospital is a technical term referring to this particular type of hospital, and district upscales the jurisdiction of the hospital, and therefore its importance slightly. The paragraph gives us two examples of graduation being used to flag attitude. So for more than 25 years, upscales the length of Piga's experience as a nurse, and therefore flags a positive capacity judgment towards her. In the second sentence of the paragraph, has taken leave is a grammatical error, which I've retained from the article itself. But the upscaling of the time since she's taken leave, since President Cyril Ramaphosa declared the national state of disaster in March, flags dissatisfaction on Piga's part. She is tired and hasn't been able to take leave since the beginning of the pandemic. National state of disaster is a technical term for the state that South Africa is in, which allows the government to promulgate certain disaster regulations. And within this, disaster flags insecurity. And this makes this word the center of a strong three-way coupling again between attitude, graduation, and technicality. Lastly, I'd like to show you the last two paragraphs of this article, which are not quite a macro new. Those are rare in news articles, but nevertheless, they contain a strong take-home message for readers. These paragraphs report the words of another nurse who chose to remain anonymous. She is from Port Elizabeth, the largest city in the Eastern Cape, which is the province where I live. In the second last paragraph, we see an instance of the collocation between the word spike and COVID-19. And here in this word, upscaling graduation couples with invoked insecurity. The nurse blames the spike on the fact that people were not following protocol, using protocol as a well-established technical term for COVID-19 prevention methods, and coupling this with a negative normality judgment. The last paragraph unpacks and expands on this idea of not following protocol. The word good gives a positive reaction to the idea of going back to level 4 or 5. These were the two highest levels, they are the two highest levels of our lockdown regulations. So this is instantiating some upscaling graduation. At the time the article was published, we were only in level 1, and we went up to level 3 about 2 weeks later. Taverns should only sell takeaways. That usually refers to down market bars and nightclubs attracting working class people. So the nurse's statement that they should only sell takeaways can be seen as a negative judgment of propriety against them for selling liquor, which lowers people's level of caution and increases the number of trauma cases in the hospitals. The sale of alcohol has been banned in the higher levels of our lockdowns. This is followed by strong invoked negative propriety against the youth for being the ones who spread this virus. The prosody of invoked negative propriety is continued in throw parties and go home to the elderly. And finally, the word vulnerable ends the article on a note of invoked insecurity. So what can we learn from all this about the way that our linguistic resources for talking about the COVID-19 pandemic developed through the course of 2020? Firstly, as I showed in the phylogenetic graph showing the collocations of COVID-19 from March to December, there were spikes of attitude and technicality at different points in the year which were associated with particular events and debates taking place at the time. However, the general trend showed the slight increase in couplings with attitude, technicality, and grammatical metaphor during the year. The micro-analyses of the two news articles I've done show, in essence, two different styles of reporting on COVID-19. The March 2020 article is an example of one type which I'll call generalized fear. This style reports national statistics and trends across the country, and here grammatical metaphor and technicality couple with attitude, extending the reach of invoked negative expressions of affect, particularly insecurity and disinclination. The use of faceless statistics may make this type of story difficult for individuals to relate to, apart from feeling a general sense of panic. The December 2020 article is an example of another type, which I'll call individualized challenge. This type gives the stories and experiences of individuals on the front line. Here, attitude and graduation are the most prominent linguistic resources used. This type of reporting is also rich in negative affect, particularly dissatisfaction and insecurity, but it's probably more accessible to everyday readers. The final two paragraphs of the second article show how this kind of reporting has added power to provoke readers to reflect on their actions and reinforce the need to take preventative measures against COVID-19 seriously. So if we're going to facilitate more constructive public discourse about COVID-19, we probably need more of the second kind of story. So in terms of future research, I think that this modest study raises some questions as much as it answers them. Firstly, it would be interesting to take the two articles I've analyzed and use them both as stimuli for focus group discussions on COVID-19 and see what real influence the two different styles of reporting have on the kinds of conversations we have about the pandemic. Secondly, I continue to be very interested in couplings between attitude and grammatical metaphor or technicality. We had some interesting presentations earlier today about grammatical metaphor in the news media, and this is one area I'm really interested in. Our theory suggests that as meanings are axiologically charged using attitude, they lose some of the density of their interpersonal meanings. As they're interpersonally charged, they lose some ideational meaning. However, I keep finding the opposite, namely that dense ideational meanings often tend to extend the reach of attitudinal meanings and amplify them. This kind of effect needs to be investigated in a lot more detail. Finally, there's still plenty of work to be done on modeling phylogenesis. In this research, I've tried to use corpus linguistics to transcend some of our limitations in this area, but I found that there's really still no easy replacement for presenting discrete snapshots of meaning making at specific points of time, like the 2 articles described in this research. If anyone knows of some methodological advances that can help us advance further in this area, please let me know. I blog regularly at this address, writing for a popular audience about preliminary analyses of online news that I've done. So please feel free to visit and read more about my analyses. And those are some references.
Very interesting. If you can put that address in the chat box, then maybe people will be able to write or see what you're doing. That's good. Do we have any questions? Any questions, anyone? We have some clapping from David and from all of us, of course. Thank you very much. Then everybody stops clapping because I usually mistake it for a raised hand. Sheena, please. Sheena has a question.
Thank you, Ian. I enjoyed that paper. Can you talk a little bit more about coupling? Does it have to work across strata, and does it have to work between such a fairly large categories, or can it be more?
No, my understanding of coupling is that it can pretty much be between anything and anything. So
Okay.
Most of the work that's been done has been done on ideational attitude couplings. And so that would be rather simple stuff like taking an appraised item like COVID-19 and saying, well, there's a lot of negative security coupled with COVID-19 in this particular case. Yeah, the term really came up in 2010. I don't know if you've seen the book, New Discourse on Language, Functional Perspectives on Multimodality and Identity and Affiliation. So there it's really introduced by Martin and Knight, and a few people like that use it. Yeah, but the range of things that can be coupled with is very broad. It even goes cross-modal. Martin and co have written a paper on the coupling of gesture with spoken language in youth justice conferencing. So yeah, it's a really flexible term in some ways, which is useful.
Yeah, thank you.
Anyone else? I was also interested in coupling. I'm glad Sheena asked that question. I'm not familiar with it, so now it's something else to think about.
Well, I've seen it in Esther Zene's work in business English. She talks about it, but I haven't read about it widely, and so, but it works well for your data, I think. Yeah.
Definitely. Anyone else? Well, thank you very much. I think there's still plenty of things to study about COVID, media, and other issues. Be interesting to study the various presentations that doctors make on television. Here in the States, we have the CDC and we have Dr. Fauci. And then we have in New York City, we have the health commissioner and the equity officer, both very interestingly explaining vaccines to people. I think it'd be pretty interesting to study what they're saying and how they do it. Some are very good. The New York City ones, the two who are now in charge, are very good. They had to remove the health commissioner, who was the health commissioner during COVID, because she was very insulting. But anyway, to the police, and very inappropriate stuff for a professional. So it'd be interesting. You could look forward to, I think, probably another year at least of COVID data. And there are many angles. So thank you so much. Any other comments, anyone? So thank you, Ian, for this very interesting presentation. And thank all of you who have presented during this last session on SFL and health. We're going to take a half-hour break for afternoon tea and more of my apple cake. I maybe shouldn't have it. I've had it in the morning, and now I'm anyway. Sorry, I can't give it to you all. And we'll be back at 3:30 for SFL and multilingual contexts here in New York. And in Canada, in Vancouver, Catherine is going to be supporting discussions of the pre-recorded presentations. So if any of you who are not presenting want to attend that, that is something that you could attend. I believe people will speak for about 5 minutes about their presentation, something to that effect, and possibly field a question or two. But there are quite a few presentations that were pre-recorded, and all of these will be available later on. So anything you've missed today or on Tuesday, you'll be able to see again.